With regard to metastatic triple-negative breast cancer, there have been a couple of studies that have looked in very large patient populations at the impact of Eribulin on the disease. And one was the Embrace trial, and it was later line therapy. Patients have had at least 2 prior regimens, but not more than 5 prior regimens for their breast cancer. And they were randomized to the Eribulin versus single agent chemotherapy of physician's choice. And there was a survival advantage in the entire treated population in favor of the Eribulin, and that led to FDA approval of Eribulin, and it really became our standard third-line therapy because of that survival advantage. Then there was another trial called Study 301, which moved Eribulin up to the second-line setting, both in estrogen receptor positive and triple-negative patients, and they were randomized between the Eribulin versus capecitabine, single-agent capecitabine. And the study showed basically the same results, both with regard to progression-free survival and overall survival, with the Eribulin and the capecitabine being very, very similar in efficacy. Interestingly, when you look at the patients that had triple-negative breast cancer, however, the Eribulin was substantially more effective than the capecitabine with regard to overall survival in the triple-negative patients, with an improvement in survival of about 5 months. So that has really put the Eribulin on the map for us as quite a non-cross-resistant regimen that we use for triple-negative breast cancer.